Rahman Rahim. My name is Dr. Imran Wahid. Today we will be starting a series of lectures on diabetes mellitus and its various emergencies related to the diabetes. But before we start diabetes mellitus, it is important to know about the normal glucose or blood sugar metabolism. Glucose is essential for maintaining the normal cellular function of vital organs like brain, liver, kidneys, and other organs of the body. The normal blood glucose level varies from person to person, and an average normal blood glucose level is less than 100 milligrams per deciliter or 5.6 millimoles per liter. So normal blood glucose level is less than 100 milligrams per deciliter or 5.6 millimoles per liter. You can multiply this 5.6 millimole by 18 and convert it into this 100 milligram per deciliter. Millimole per liter can be converted into milligram per deciliter. So normal blood glucose level varies from person to person depending upon the body stature, body mass index and state of the patient, but average blood glucose level normal person is less than 100 milligram per deciliter. There are different levels of decreased blood sugar or hypoglycemia and increased blood sugar or hyperglycemia. So we will start with the normal blood glucose level or blood sugar levels in the body. As I mentioned, normal blood glucose level is less than 100 milligrams or 5.6 millimoles per liter. This is a fasting blood glucose level. Fasting blood glucose level means that it is the level of blood glucose calculated after 8 hours of fasting. So this is known as fasting blood glucose level or FBL. So it is less than 100 milligrams or 5 milligram per deciliter or 5.6 millimoles per liter. Random blood glucose level is a level of blood glucose which is not in the fasting state but after taking meals. So average normal blood glucose level is less than 100 in fasting state, but in random state when the patient had taken the meal it is 125 milligrams per deciliter or 6.9 millimoles per liter. This is the random blood glucose level, that is when the patient has taken the meals. It is important to understand these blood glucose levels because only then we can understand what are the various implications of diabetes mellitus, hyperglycemia and hypoglycemia. If you don't understand normal physiology of the blood glucose, you cannot understand these complications of the diabetes. So what is the pre-diabetic state? Between blood glucose levels between 100 to 125 milligrams per deciliter, that is 5.6 to 6.9 millimoles per liter, is the pre-diabetic state. But when the level is more than 126 milligrams per deciliter or 6.9 millimoles per liter, this is declared as a diagnosed case of diabetes mellitus. According to American Diabetic Association, this is the regulatory body ADA which is being followed by all over the world by the diabetologists. So this is important to understand so that we can find out what are the various implications of diabetes mellitus in case of hyperglycemia or hypoglycemia. Another important implication is to know that what is the level of glycosylated hemoglobin, glycosylated HB. The hemoglobin is glycosylated, and this glycosylated hemoglobin or HbA1c levels is very important. It provides us information about the levels of blood glucose over last 3 months. Nowadays, according to American Diabetic Association, this is the most important criteria for diagnosis of diabetes. As I have told you that normal blood glucose level is fasting level is let us say between 80 to 100 milligram per deciliter or less than 100 milligram per deciliter. So or 5.6 millimoles per liter, as I have earlier discussed with you. So HbA1c at this level should be between 4 to 5.6. This is the HbA1c level. Fasting blood glucose, and this is the normal HbA1c level at the fasting blood glucose of 80 to 100 milligrams per deciliter. When the level is more than 126 milligram per deciliter, level is more than 126 milligram per deciliter or 7 millimoles per liter, this is declared as diabetes mellitus. After food, when the patient has taken the meals, 2 to 3 hours, let us say, after the food, 2 to 3 hours after meals, the blood sugar is 120 to 140 milligrams per deciliter or 6.7 to 7.8 millimoles per liter. These are the levels after 2 to 3 hours of the meal, and this range is known as pre-diabetic state or impaired glucose tolerance. Pre-diabetic state. Similarly, any time after the food, if the level of blood glucose is between 170 to 200 milligrams per deciliter or 9.4 to 11.1 millimoles per liter, this is diagnosed case of diabetes mellitus, that is more than 200 milligram per deciliter any time after the food, the patient has taken the food. These are the important levels of blood glucose which you need to know before we discuss further implications and problems of the diabetes mellitus. So diabetes mellitus is diagnosed in different tests. One of them is fasting blood glucose, random blood glucose, and HbA1c levels. Another test is very important, and that is known as oral glucose tolerance test or OGTT. Oral glucose tolerance test is an important test for diagnosis of diabetes mellitus, diabetes mellitus during pregnancy and other individuals. The procedure of performing oral glucose tolerance test is that patient is kept on 8 hours of fasting, no fluids, no drinks at all, and no smoking as well. Patient will not go for smoking, no food and no drinks at all. Then a blood sample of the patient is taken, blood sample in this fasting state, and it is measured. Blood sample is taken before starting the test. In third step, we give an oral drink containing 75 grams of glucose or sugar containing 75 grams of glucose or sugar. It is given to the patient and is preferably in liquid form. Preferably in liquid form because it is absorbed early. So when we give it in liquid form, we see that oral glucose tolerance test basically it means that how the patient tolerates the a load of glucose when it is presented to the body. So we can see that if we draw a graph of this test, we see that on a y-axis, a long axis, y-axis and x-axis, here we have 0, 30, 60, 90 and 120. This is the time in minutes. Time in minutes. And this is the blood glucose level. Blood glucose level. Starting from 50 milligram per deciliter, 100 milligram per deciliter, 150, 200 and 250. Let us say milligrams per deciliter. Time in minutes. This is in milligrams per deciliter. Blood glucose level. We can see that initial point is 0 minutes. This is the initial point and it is 0 minutes. We have already taken a sample of the patient and measured it in fasting state. In first hour, we see that after giving 75 grams of glucose, blood glucose starts rising and it may reach up to 180 milligram per deciliter, but within 2 hours it returns to the baseline. So if we plot the graph, we see that it behaves like this. Glucose starts from here, starts rising. After giving glucose, it reaches up to 200. Then after 1.5 hours starts falling, 30, 60, 90 and comes to baseline. This is the graph of oral glucose tolerance. At 30 minutes, 60 minutes and 90 minutes and 120 minutes, we measure the blood glucose level. It rises up to 180 to 200 milligram per deciliter and in normal person returns to baseline within 2 hours. If it does not return to the baseline after 2 hours and the levels are more than 200 milligrams per deciliter, diabetes mellitus is diagnosed. And when it is between 140 to 200 milligrams per deciliter, this is the impaired glucose tolerance. Glucose tolerance. According to latest guidelines of American Diabetic Association, impaired glucose tolerance is equivalent to diabetes mellitus and needs treatment and intervention. So it is important to understand that this is the normal glucose metabolism and normal values of the blood glucose in the body of a normal human being, and various tests of diagnosing diabetes, that is fasting blood glucose, random blood glucose, oral glucose tolerance test and HbA1c levels. Now we will start discussing important points, and they are diabetic emergencies. First of all, the most important diabetic emergency which is encountered in most of the clinics and emergencies is hypoglycemia. Hypoglycemia means reduced blood glucose level below normal levels. So what is hypoglycemia? Hypoglycemia is a medical emergency when there is a fall or there is low blood glucose level. The blood glucose level drops too low for the body to function properly. What happens is that, as we know, glucose is required for normal functioning of the brain, heart, kidneys and all vital organs of the body. So there are different causes of hypoglycemia. Hypoglycemia have different causes. Patients can suffer from hypoglycemia due to different causes, not only diabetes mellitus but others as well. When a patient has reduced blood glucose, the symptoms can range from simply tremor in the body, sweating and confusion, and up to the level of unconsciousness. Patient can become unconscious, and loss of consciousness is an important symptom. When blood glucose levels drops, the patient can have changes in the body like tremors, shakiness, sweating, hunger, confusion and dizziness. Heart rate increases and there may be tachycardia and pallor of the skin due to sympathetic activity. Behavior can also change. There is decreased cognition. Glucose supply to the brain cells or neurons results in confusion. There is difficulty in concentration. Irritability may be there. Nervousness may be there. Moodiness and trouble with thinking clearly. In severe hypoglycemia, when there is prolonged prolonged hypoglycemia can lead to residual brain damage. That is, it can damage the brain permanently. It's called brain injury. So this is very important to treat it in time. Causes of hypoglycemia are different. As we know that in diabetic patients, the most important causes of hypoglycemia include due to side effects of an oral hypoglycemic agent or drug which is being taken for control of diabetes, or side effect of insulin, oral hypoglycemic agent tablet or insulin injection. The side effect of hypoglycemia can occur as overdose and side effect of these drugs. Insulin in overdose can result in hypoglycemia. Another important thing is that patient is taking the drug but not taking the food. Drug is being taken but food is not being taken, as a result of which patient can have hypoglycemia. Other causes of hypoglycemia are important. There are the causes in diabetic patients. In normal individuals, normal human beings who don't have diabetes, who are not diabetics, important causes are starvation, not taking food for a long period of time, going on a dieting severely, anorexia nervosa, bulimia. These are important medical conditions. And of view, that is, you can see that if a patient presents to your emergency department or your hospital with hypoglycemia, that is, blood sugar level is less than 100 milligrams per deciliter. How we define the level of hypoglycemia and how we treat it? Hypoglycemia has 3 levels. Level 1 is known as alert level of hypoglycemia. In these cases, blood glucose is less than 70 milligrams per deciliter. 70 milligram per deciliter or 3.9 millimoles per liter. So this is the level of hypoglycemia in level 1, where we have to be alert. The level is less than 70 milligram per deciliter, but not less than 54 milligrams per deciliter. It is less than 70 but not less than 54 milligram per deciliter. Level 2 hypoglycemia is known as moderate to severe hypoglycemia. Moderate to severe hypoglycemia. In this condition, we can have blood glucose level less than 54 milligrams per deciliter or 3 millimoles per liter. Is less than 70 and less than 54. This is clinically significant. And level 3 is severe hypoglycemia. Severe hypoglycemia. In severe hypoglycemia, the blood glucose level is definitely less than 54 milligrams per deciliter or even less than that. In this condition, the patient can have all the symptoms of hypoglycemia and the person is unable to function properly. There is dull sensorium, confusion, and in some cases so much mental and physical changes that patient becomes unconscious. Patient can become unconscious. So it is important to understand these levels of hypoglycemia. Now once hypoglycemia is diagnosed, how to treat it? Treatment of hypoglycemia is definitely based on diagnosis. Once we have diagnosed hypoglycemia, it is a medical emergency and we need to intervene immediately. First of all, check serum glucose when patient presents to you in the emergency department. First of all, you see the patient is in state of confusion, patient is having sweating, tremors, pulse rate is higher, and patient is in impaired state of consciousness or dull sensorium, patient not responding properly, or there is impaired concentration and confusion. Immediately check the blood glucose level. This level will tell us whether it is an alert, moderate to severe, or severe hypoglycemia. Accordingly, take immediate action. What immediate action should be taken to treat hypoglycemia? That is, number 1, once diagnosed, immediately give to the patient a quick source of glucose, preferably in gel or liquid form, as I mentioned earlier. That is, I mentioned earlier that it should be in liquid form, such as sweet juice or syrup containing sugar. Glucose gel or tablet should be avoided. Fruit juice or regular soda can be used which contains glucose level. Then after giving this glucose drink or sweet preparation, wait for 10 to 15 minutes. Wait for 10 to 15 minutes and recheck the blood glucose level. If there is no improvement, then repeat the same sugary drink. Same sugar drink. And then again wait for 10 to 15 minutes. After waiting for 10 to 15 minutes, if there is some improvement, continue treatment. Till the patient is stable. At this stage, if the patient is stabilized, well and good. If does not stabilize, again repeat after 10 to 15 minutes sugary drink. Once the patient is stabilized, we can give a snack, small snack or meal to the patient. If it is time for the lunch or dinner, we can give a full meal as well, which contains good quantity of glucose and blood sugar at the level it is stabilized. As I mentioned, in cases of severe hypoglycemia, in those patients who have severe hypoglycemia, we need to take serious rapid action because it is a serious condition. It is a condition where patient is obtunded, has an obtunded state, is semi-conscious or weak enough to treat himself or express himself. In these cases, in severe hypoglycemia, injection glucagon is used. Freshly prepared glucagon is given, but another precaution is that it has to be prepared freshly and given immediately. Hypoglycemia has a tendency of recurrence. Hypoglycemia can occur again and again. So once you have stabilized the patient, preferably continue an infusion of glucose or give sugary drinks to the patient at regular intervals and keep on monitoring the blood glucose level. Once the patient is stabilized, you adjust the dose, and after stabilization we can send the patient to discharge the patient and send out of the hospital on medical management. Always remember, hypoglycemia has to be treated in time, and if it is not treated in time, it can lead to dire emergencies and residual brain damage. So hope you understand it. If you have any queries, you can ask it. Then in next lecture I will discuss about hyperglycemia and its implications and various complications of diabetes. You should watch the video till end and subscribe the channel so that you can get the updates about other lectures about diabetes mellitus, and similarly click the bell icon so that you can get updates about our future plans and lectures. Thank you very much.